Welcome to Real Talk, the podcast where we get honest about health, healing, and everything in between. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today, we're exploring a topic that deserves more attention: menopause. It's something every woman will face, but may still feel very confused, unsupported, and flat out ignored when symptoms hit. We'll also touch on andropause, the lesser known male equivalent of menopause, and why men often fly under the radar when it comes to hormone shifts. Joining me today is Bernadette Talley, a registered nurse with over 30 years of experience and an author. Bernadette brings a rare and powerful blend of both personal experience and conventional medicine insight to this conversation. She also walked through this transition herself and spent decades guiding others from both a clinical and compassionate perspective. This is going to be a real, relatable conversation about what's happening in the body, what to expect, and what you can actually do to feel better, without shame and confusion. This podcast for educational purposes only. We do not diagnose, treat, or cure any illness or disease. So let's get started. So how you doing, Bern?
I am doing fine, and I'm happy to say that I'm postmenopausal finally. Menopause, puberty's evil older sister.
Yeah, so please tell everyone about yourself.
I've been a nurse since 1987-ish. Had the privilege of working at some pretty big name places, University of Chicago, Loyola, Northwestern. Did a lot of work with women as far as breast cancer reconstruction and a lot of like general kind of, physicals and things like that. It's been a long and varied career. Now I'm doing some school nursing, which is fun, and I do love the calendar.
If you don't mind me asking, what is your age?
I am 68 years young. I'm younger than Moses. You can just say that.
And we know you're an author too.
Oh, yeah.
If you wouldn't mind telling people about your different books.
Oh, sure. Absolutely. I have two books that are currently on Amazon. They are under Bernadette Hanson because I've married since then. So keep that in mind. One of them is Breast Cancer Silver Lining, what you need to know about your reconstructive options. Most of that book is still very relevant, although I'm happy to say that some of the information is actually updated since the book came out. The other one is 30 More Days with Jesus, which I just get chills still when I read it. I love that book. It's just a daily devotional.
No, that's excellent. Yeah, congrats on that, the success of your books. Initial segment one, we're going to talk about perimenopause, the storm before the storm. This is a subject I think not a lot of people know. Perimenopause is the phase where most women never see coming because no one talks about it. It's not menopause, but it's when the body starts making hormonal shifts that lead to it. So, Bern, do you think that most men and women know about perimenopause?
I think the confusion is you don't know exactly when it's coming and what symptoms you're going to get. They used to tell us in my day, they would say, if you want to know what childbirth is like for you, ask your mom. If you want to know what menopause will be like for you, ask your mom. But then some of us got pushed into it early against our wills. So there's just not enough information at all. No one can really pinpoint it. It sneaks up on you.
Yeah, because I see many posts online and questions from women mentioning their symptoms and automatically assume they're menopause, which understanding, man, messed up here. I see many posts online and questions from women mentioning their symptoms and automatically assume they're menopause. And a lot of people I don't think understand what perimenopause is. I think that's where the confusion is.
Oh, that is true. I had a friend actually, a fellow nurse, and she was like in her early 50s and she had all these various symptoms and she was freaked out. She was scared. She had no idea what was going on. She went to the doctor. She goes, I don't know if I'm dying or I have a disease. What's going on? And he goes, you know what? All of these fall under menopause. And so she actually got, in her case, a hormone supplement and actually had a good ending to that story. But it can be really scary because you don't know what's happening. And some of these symptoms come together, some of them come all by themselves. If you are suddenly hot, is it a fever? Is it an allergic reaction? What is it?
Perimenopause can begin as early in your late 30s, early
Mhm.
40s, and it's driven by a slow, uneven decline in progesterone,
S
following later by fluctuating estrogen and testosterone. Periods may still be regular or completely erratic. You might feel completely normal one month and like a different person the next month. So we're just touch on little common signs on my side, then I'll let you touch on common
Sure.
signs you're aware of. Heavier, more painful periods, anxiety or mood swings, sleep disturbances, breast tenderness, brain fog, midsection weight gain, shorter menstrual cycles, and I know you have a longer list.
I do. I'll just be quickly going over this. So hot flashes, but you can also get a cold flash. I've had that where it feels like a popsicle in the middle of your body and it just spreads out. Nobody talks about the cold flash. That is horrible. Night sweats, everybody knows about that. Clammy feeling, heart palpitations. Am I having a heart attack or what's going on? Irritability, mood swings. Are you a woman? Is it because men are from Mars and we're from Jupiter? I don't know. Trouble sleeping, irregular periods, low sex drive, fatigue, anxiety, lack of focus. What is that? Am I getting older or am I having a problem? I can't remember where my keys were. Faulty memory. Incontinence. That's a nice one. Thank you for that. Itchy, crawly skin, achy joints, tense muscles, headaches, digestive issues, bloating. On top of if you come through puberty, menstruation, pregnancy, and delivery, and now you have this to look forward to: weight gain, hair loss or thinning, facial hair, wahoo! Vertigo, change body odor, that's a good one. Tingling of extremities, bleeding gums, chronic bad breath, osteoporosis, which is really a big thing for women, weakened fingernails, and ringing in the ears. Now, would you ever put all of those under one umbrella?
Not at all. And I think the problem is many women aren't told these symptoms could be hormonal. They're misdiagnosed with depression, anxiety, and even early menopause when really it's perimenopause.
Exactly.
You helped a lot of women as being a nurse, and you also lived through this yourself. So, what was your first personal experience with perimenopause, and how did your medical background influence how you interpreted it?
So I knew about the symptoms. There's the symptoms is like this huge umbrella. It was in the wintertime, and I distinctly remember it because I was waiting on the corner. I was actually working at University of Chicago, and they had a shuttle. I started to feel this heat in the middle of my body, and I knew that my face was turning red, but it was winter. I'm all bundled up. People started getting close to me. I'm not kidding you. I was giving off heat. I was glad to give it away, but it was so weird. And then it happened a week or so later, and I was actually inside the building. I didn't have all of these clothes on and stuff. And I'm like, oh, holy cow. I felt my face getting red, literally had all this perspiration. And it comes on and it stays for at least a minute and then it leaves. And then you're cold. You're cold and you're cranky and you need chocolate.
From the clinical side, were you prepared for perimenopause?
No,
Just knowing that based on your experience?
yes
Like
and no.
the symptoms.
Yes and no. You know what the symptoms could be, but it's so personalized. Some of these women, and I hate you because, gosh darn it, you just had these mild symptoms and you just went on with your happy life. So, not everybody has the same degree of symptoms. And that's another thing, too. It's like you can't even ask your best friend, how are you doing with this? I'm doing fine. Great for you. But those of us who've gone through the stronger symptoms and the more diverse symptoms, you just don't know where this is coming from. And you do actually start to doubt yourself. You're like, okay, wait, I don't want to go to work ever again. I can't find anything and everyone is irritating me. It's like, I just want to line up and have everybody just do batting practice. These bad moods just come out of nowhere.
Yeah.
I'm not a bad mood person.
She's kind hearted and always funny. I realize for perimenopause, it doesn't always show up neatly on lab results, right? It's a
Exactly. It
pattern.
doesn't.
It's a cluster of changes, and most medical doctors aren't trained to look at the full picture.
That is so true, and I'll tell you the truth. They have 1 or 2 things that are basically, this is what, we're gonna use here. Whereas, like, I noticed with Mindful Objective, you have this whole collection of lab tests that looks at these things all in a big picture, which I was very impressed with. But when you go to the regular doctors, you're right, even me, myself going, okay, where am I at in this big picture because I'm tired of this. They only give you, like, 1, maybe 2 blood tests. They barely explain it.
And that's the downside is they might run labs, but they're not in-depth labs, right?
No, they are not.
And that's where we correlate that information. Just because one lab marker is off doesn't mean there's an actual issue. You have to correlate the different
Exactly.
lab markers together to find out the actual issue. From an integrative health standpoint, we focus on the totality of a woman's experience, not just her cycle or her labs. We always ask about sleep quality, stress and cortisol levels, liver function, detoxification, nutrient status, especially B vitamins, magnesium, and zinc, blood sugar regulation. We also do functional testing like a Dutch hormone panel. This will show you what's really going on throughout your day, not just at 8 a.m. when a single blood draw is taken. And that's where it's usually at from a clinical perspective of,
Exactly.
hey, just run your labs this morning and yeah, I didn't see anything wrong, but they don't look at your whole lifestyle habits, emotional patterns, stress resilience, because those directly influence hormonal transitions.
Absolutely. And I was gonna say what I've heard on your other podcasts is when you go for these lab tests and you're expecting an answer or an explanation and you get, well, it's normal. And then I've heard you say over and over, normal is not optimal. I want to be optimal.
Yes,
And if I am no better off than before I took this blood test, oh, you're normal. Now what? Now I don't know what to do.
exactly. Because you run out of thoughts too. A lot of people just listen to the medical doctor and, like you said, oh, your blood test coming back normal. Then you get frustrated. Like, what is wrong?
And there's a lot of remedies, if you will, in the drugstores and in this one little section. And I hesitate to even think about those because how does it react with the other things going on in your body? How do you know you should take it? Are they regulated? It really scares me that they have these kind of remedies. To go in, buy them, go home. I think it's dangerous.
I think a lot of people blindly supplement, right? And
Exactly.
they're not sure what they need. Well, again, their medical doctor says they feel normal, or you may be having low estrogen. Like your lab work from a medical doctor might come back and say your estrogen's on the low side, but it's normal. You're fine. And again, that's
Exactly.
not
That's not
optimal.
helpful.
No, it's not
That
helpful
doesn't
nor
tell me a
optimal.
thing.
Perimenopause is not a medical emergency. It's a shift.
Don't let us get that far.
Yeah,
Um,
you want to definitely rebalance your body before things become more difficult down the road.
Absolutely.
So, from a personal conventional medicine perspective, have you ever experienced a medical doctor talk about looking into what we look at from an integrative side?
I've never heard a medical doctor even reference. No.
Because they definitely don't look at the root
I don't
cause.
think they're versed enough in it.
No, and it's no fault of their own. It's just that's their education and that's
But you
the
know what it
different
is?
career paths.
You're a hammer, everything's a nail.
Yes.
You have to look at the whole person. This has been such an eye-opening experience for me because all this time I've been conventional. Is it repeatable? Is it scientific? Is it something that's been proven? But I'm realizing that in the conventional world, it's a very narrow view.
Correct.
It's a narrow view, which would be okay if it was correct, but it's not because there's so much other things there. We're spirit, soul, and body. You have to look at a bigger picture. I want the whole picture, especially when you go in for these menopausal blood labs and things like that. Maybe that one test or those two tests, it's just not enough.
Because they definitely don't look at the full picture of the root cause.
Exactly.
And two, you did run those different labs. And normally, if you did just blood work, it would have came back, oh, this is fine. You're, again, on that low side, you might be high here, just eat a balanced diet. But what's the actual root cause of that? If you're born with cerebral palsy, Down syndrome, right, you have that. But a lot of these other things, there's a root cause behind it. You got to approach it properly and see that whole picture and understand how do I fix and correct my nutrition and what supplements do I need to take? And is it long term versus short term? And what's the benefit going to be by rebalancing that body?
And I'd like to make a point. Some of us are so sick of taking pills. I don't want to be on something forever, okay? I would rather have the option to rebalance, get to a point where I can wean off of that and go on with my life. Nobody wants to haul around a bag of pills with them all the time. I've seen so many patients and you're taking their history and they give this bag to you. They don't even know what it is. They know when they're supposed to take it. Just this whole option and this idea of, well, wait, let's see where you are. Let's see how we can rebalance. And you know what? You might not have to be on that lifelong.
For my example, outside of migraines, is high blood pressure. I had high blood pressure my whole life, and doctors right away, they don't test your heart or anything and say, you know what, take a blood pressure medication or water pill. But for me, I took berberine and it ended up being my blood pressure is normal now and it was due to insulin resistance. Nothing wrong with my heart. So it's like a lot of things people don't know. And again, it's education. That's what we're here for. So the next segment we're going to talk about is actual menopause, more than just hot flashes. By definition, menopause begins after 12 consecutive months without a period. For many women, this occurs between ages of 45 and 55, but the transition varies widely. The term menopause is often used to describe everything from the mood changes to weight gain, but it's just one phase in a much broader hormonal story. So what's actually happening? Estrogen and progesterone levels continue to drop, sometimes dramatically, affecting everything from metabolism to brain function. Testosterone often declines as well, contributing to loss of muscle mass, decreased libido, and fatigue. And symptoms of menopause usually are hot flashes, night sweats, vaginal dryness, joint stiffness, poor concentration, anxiety, skin and hair thinning, insomnia, digestive issues. So Bernadette, Bernadette, from a perspective as an RN and someone who lived through this, how were you taught to approach menopause in a clinical setting And how did you compare to your personal experience? And if you want to touch on how you ended up in menopause.
Oh, sure. I was actually having some problems with the monthly periods. And of course, I'm going in every year to get exams and stuff like that. And the one thing that everyone dreads is that phone call that says your pap smear is abnormal. So the first thing they're going to do is repeat the pap smear. Okay. Came back abnormal a second time. So now what they want to do is take a biopsy. You never want to hear that phone call. You need a biopsy at this point. Went in, they found cancer and gave me some options. First of all, surgical. And they said, well, here's the scary part. They said, we don't know exactly how far spread it is. So we're going to have to do other testing and other imaging. And that is awful to hear that and have to wait and do that. But once they determined for me that it was pretty much contained, they did go ahead and do the hysterectomy. And that puts you immediately in menopause. And I think I was what, 36 about? Yeah, maybe 36. Here's another thing. When you're given that option and you're looking at your 2 kids and you're thinking, geez, I do not want to repeat this. But as soon as you find out that you can't repeat it, and there's an unspoken mourning and a grieving there because now you can't. And I don't think anybody talks about that. Now the option's gone, but you'll be living. It's not an easy thing. It's actually, it turned your life upside down. I literally started nursing school like a month after my hysterectomy. And I think in a way it helped me to be more sympathetic to patients. But there were some things I liked. Okay, I didn't have to do the monthly thing every month. So I like that. But you still have all of those things that we mentioned earlier, from the night sweats to the flashes, being hot and cold, to the mood swings. And you don't know where it's coming from, and people think you're absolutely nuts. Should I go to a therapist? Should I now go on and get something like an antidepressant or something like that? And you think you're absolutely crazy, but it's all under this umbrella. And it takes a while to adjust.
And I don't think people understand, men and women, how important hormones are to the
Mm,
body and how to properly check. Because medical doctors do not properly check your hormones. Yeah, if
mm,
you go to a hormone clinic, they will, because that's what they specialize in. That's all they do all day long. But
yes.
outside of that, most medical doctors do not review any
How do you
detailed
get to
labs.
that specialist? You have to have symptoms or you insist on it. You have to ask for it, go after it. You're not just going to be offered that.
And I think that's why hormonal clinics are so popular nowadays.
Mm.
You could go online, order hormones, get on testosterone replacement, hormone replacement therapy, progesterone so easily nowadays. And it's through obviously a medical provider, but that these clinics are just hormone clinics and it's just like pump and dump. And they take anybody on, and is it a money making scheme or are they really helping people? I think it's like 50-50. You have the
Mhm,
places that are just doing it to make a quick buck.
mhm.
And just because your levels are low or not optimal, or sometimes your levels are fine, but you just have symptoms. So right away, they'll prescribe hormones for you. And so what does that do to people long term? Right? It damages their body more because that's not the root cause of the issue, right?
In my experience, being in the medical field for all of these years, is that when you go to conventional medicine, and I love my doctor, but the band aid is the first thing that happens, the band aid. And even I've seen people who start on one medication and because of the side effects of that, now another medication. And because of the side effects of that, now another medication. And it seems like this endless list of let's treat the symptom. When do we get to the root?
And I think the other side of that too is medical doctors do not do research on the connection between all those medications and what they're doing to the body.
Yes.
So that's where you're your own advocate. You have
Yeah.
to do that research. If you're going in, a lot of people go in and say, I have this symptom, and your doctors, just based on looking at a book or their contract with insurance companies, they say, okay, for this symptom, you take this medication. They don't ever say, why do you even have that symptom? So that's why we look at the root cause. This is exactly where integrative health excels in this field is we don't just ask, what can we give her for her symptoms like medical doctors? Instead, we ask, what's her body trying to tell us? Is her blood sugar crashing at night? Is she low on magnesium or B6, both critical for hormone metabolism? Is her liver sluggish, contributing to estrogen buildup or poor clearance? Is her microbiome inflamed, leading to poor estrogen recycling? In her microbiome inflamed, leading to poor estrogen recycling via
Oh,
estrobolome.
sounds
We might recommend magnesium glycinate for sleep, DIM and calcium dichlorogenate for estrogen detox, DIM and calcium D-glucarate for estrogen detox, ashwagandha, rhodiola for adrenal support, omega-3s and protein to help the brain function and mood, So menopause isn't failure of the body, it's the reset point where women are empowered. With the right tools, it could become a time of incredible mental clarity, creative, and growth. Just based on that, I think a lot of people do not know the difference originally between perimenopause and menopause,
You
right? And
can save yourself a lot of anxiety and fear because all of these symptoms that come up, do not go to Google. Do not ask your mama's brothers, cousins, sister-in-law. Don't do that. You need to go to someone who can look at the whole picture. These doctors, I'm going to be honest with you because I've worked with them so much. They have a schedule. Now, you're probably not getting in at your time, and that's okay because the person before you was talking too much. But I'm telling you something, they are on a schedule. They're supposed to produce. It's a business. Okay, I'm just be honest with you. It's a business, okay? They're going to pretty much put you into this little form, meaning, okay, these are the symptoms. This is what we're taught. This is how I think I can help you. And it's all preformed. It's preformed.
yeah, and it's
And they are on a schedule. They get bonuses based on this. They get dings if they don't see enough people. I'm telling you, it's a business.
yeah, for sure. And the next thing we're going to touch on too is the emotional side,
Mm.
identity, confidence, and those mood swings.
Yes,
So one of the most underrated discussed aspects of menopause isn't physical, it's emotional.
exactly.
The hormone shifts that happen during perimenopause and menopause can affect neurotransmitters like serotonin and dopamine, which directly influence mood, confidence, motivation, and emotional resilience. A lot of women often describe this feeling as irritable, less confident, disconnected from identity, or indifferent about things they once loved, more prone to crying and anxiety, all things I don't want.
I'll tell you what, one of the worst things that happened to you during menopause has to do with your hair. Your mustache is better than your husband's, and that's problematic a lot. And your hair on your head is thinning. There's nothing worse for a woman than to have that thinning hairline. It's terrible. It takes all of your confidence away. It really does. An awful, awful thing. The other thing is you don't know what is going to set you off. You are trying to be a normal, nice person, but anything can really just set you off. It's that emotional thing that just kicks in. You don't want to be like that. It's almost like you have the right to remain silent, but you do not have the ability, that thing.
Yeah.
But that hair thing, let me tell you, you have hair on your chin, you have hair on your upper lip. It is terrible.
It's not just about being moody. These are real biochemically driven changes that deeply impact relationships, careers, and even your self worth. From a clinical perspective, how is the emotional impact of menopause typically treated?
I don't think it's even talked about. I think that if you have any emotional symptoms at all, they don't connect it with that. They just connect it with, oh, you're in your 50s. Oh, you have this pressure and that pressure and this pressure around you, like you're taking care of your parents. You also have grown kids. You're still working. They don't really connect it, I don't think.
Say you went to your medical doctor and you told them, I'm having these symptoms, I'm crabby all the time, all this stuff.
Mhm.
You're kind of withdrawn from people and stuff too. I imagine the first thing they do is maybe you need an antidepressant or,
Behavioral health.
yeah,
Referral, behavioral health.
you have menopause, or the doctor will say you have menopause, perimenopause, but it sounds like you have depression now. So take a pill. So rather than saying, okay, let's look at that root cause. Are you deficient in any,
Exactly.
nutrition? How's your diet? How's any of that stuff? Can we address your symptoms based on deficiencies? They don't, and again, they're not trained in that, so they do not look at that. But can you minimize the symptoms based on supplementation and nutrition? And a lot of times the answer is yes. Like nothing's perfect, and each individual person is going to respond differently, but there are things you could do.
Well, if it's actually this long-term decrease of these things that you need, why wouldn't you try to replace some of that? We're looking at a decrease going in.
I think the thing goes back to education. A lot of people just don't know that. They're just blindly follow what their medical doctor says. I always think about that from the same aspect of blindly following something on social media.
Exactly. And here's the sad part too. If you go in there and respectfully, you're having this kind of back and forth with the doctor, they can get very testy.
Yes.
I'm not trying to say that you don't know something. I'm just trying to say, can you explain it a little better? I'm not really getting that. I'm trying to show you the bigger picture here, but I don't know if you're hearing me. And they get really testy.
It's a different world, and it depends who they're employed by and their goals. That's why I don't blame a lot of medical doctors. They understand or see the symptom and understand This is the treatment for that symptom. They're not familiar with what a root cause is or what it does.
Sad.
Luckily, I go to a medical provider that's into Ayurveda and stuff also. Same with his patients. He would refer them over to us, or he would try not to give any kind of medications or extra testing when it's really not needed. And you don't see a lot of medical doctors like that because it's a business for them.
What if we believe Ecclesiastes where it says there's nothing new under the sun? Maybe these kind of nutrients and supplements have been here the whole time
Oh, yeah.
in different forms, and people have been using them. Here's a soup, it'll make you feel better or whatever. And maybe it's been there the whole time. Where did pharmaceuticals come from? They're a synthetic form of what was already here.
Exactly.
You didn't invent anything.
Yeah. But you can't patent a plant.
Use it
Yes.
if you know how.
The kind of emotional fog is incredibly common. That's why integrative looks beyond prescription to address at the deeper roots. Here's how often we evaluate this is cortisol patterns, right? Chronic stress and flatline cortisol can feel like depression. Neurotransmitter support, amino acids like L-tyrosine or 5-HTP may help naturally. B vitamin status, B6, folate, B12 are crucial for mood and energy. Progesterone levels, low progesterone can lead to anxiety and restless sleep. So these are things that normal medical doctor will not look at.
For sure.
Yep. So we also focus on reclaiming identity, right? Many women have spent decades nurturing others, kids, partners, careers. Menopause can feel like the first time they ask, what do I need? Tools like journaling, somatic therapy, breath work, and coaching help reconnect them with themselves, not for emotional grounding when hormone ground is shifting beneath them. Right? So menopause isn't just biological shift, it's a spiritual and psychological transition too. And it deserves support at every level from everybody.
Every menopausal woman listening to this right now just said, thank you, Dr. Sproul. Thank you for recognizing that. After I went through the periods and the childbirth and the breastfeeding and the menopause and all of that stuff, now you're going to do something for me? Thank you.
The next part we got to talk about though is what about men? We got to understand
They're
andropause.
from Mars.
A lot of people don't know the word andropause. They're just hear menopause and think only women go through it. But while women face a well-defined hormone transition, men experience their own version, a slower, quieter process, often referred to as andropause. How many
I-
people you think know about that?
I don't think all the men are so quiet. There's one in my life that isn't quiet at all.
Speaking on that, your husband, he's on the medical field too for how long?
He's been in the medical field for, I don't know, 30, almost 40 years.
Yeah.
But he's not quiet at all. He's not quiet. I can tell when he's getting to that point. Maybe it is andropause. We've had this conversation before. Are you going to do like that? Are you going to wear that? Do you realize how close you are to that car? I told you before. What's happening here? I think what happens is their medicine is lows. They go into the lows and they get happy.
Yeah. We know that with Geraldo, right? He lives the hardware store too.
Hey, this is your medicine.
Unlike menopause, where estrogen and progesterone levels drop significantly, andropause involves a gradual decline in testosterone, often beginning in the late 30s or early 40s. By the time a man reaches his 50s and 60s, the effects can be pronounced. So common signs of andropause include lower libido, erectile changes, loss of muscle mass, increased belly fat, mood changes, irritability, poor motivation or focus, fatigue, and poor sleep. Good one, because we just tested you and your husband. When we look at that, how many times did his medical doctor, because how old is your husband?
Is 63.
In 63 years, how often did a medical doctor at age, say 63 now, test his testosterone?
Not since I've been with him. Not since 2011. No.
See, and that's,
They do the PSA.
yes,
And
for the
that's it. It's
prostate.
like, there's a standard PSA, you're good go.
They never check hormones
No.
at all.
No.
As we age, our testosterone stuff declines, like it says here.
You're going to make
And
me feel sorry for him. Now he's got a reason.
yeah,
Jeez
andropause.
Louise.
It's a different world a lot of people don't know, but
But
that's
does
why
it make a man like bossy though?
that's the big pickup truck. It's like a lot of men, like even in their 30s, 40s and stuff, have symptoms of low testosterone, but their medical provider does not check. Regardless how many times you say, oh, I want to check my testosterone. Oh, no, you're fine. Because we hear all the time. A guy will go to their provider and say, I want to check my testosterone because of these symptoms. And they'll say, are you still getting erections? And if they say yes, doctor, oh, you're fine. You don't need anything. And that's ridiculous. We test them and find their testosterone's very low. So there are different things and different symptoms for different people. Just like women, men and women have different symptoms, not just based on lab work. But there are different hormonal changes and stuff that need to be addressed. And again, you want to be not just okay, you want to be optimal.
And to stay on point, when my husband had this testing done by you, and he got back those results and you start explaining to him, you know what? I did feel like, "Oh, okay, I get it now." And now we have the supplements and now we can actually do something about it. It's not being swept under the rug, it was explained to us. And it was an eye opener because we didn't know that. We didn't know the kind of lab results that he was gonna get.
If anybody out there listens to the podcast prior to this one, episode 36 about testosterone replacement therapy, there's different avenues on why and different root causes on why your testosterone or hormones are low, right? It could be based on nutrition. Not everybody needs hormone replacement therapy. Some do, right? Because actual health issues. But other ones, it's just based on nutrition. So if you get vitamin D3 up high enough, you get DHA up high enough, zinc high enough, a lot of times too, your testosterone will increase. But for those people that do actually have a medical condition, hypogonadism and so forth, they may need testosterone replacement therapy. It all depends, but that's where functional lab testing is so important. Obviously, you're a nurse for a long time. Did you ever work with any men when it comes to any kind of settings like this? Or
I worked in urology for a while.
okay,
So we had impotence and we had all kinds of issues, urinary issues, stuff like that, endoscopies. Yeah, so I did work in urology for a while.
because it could affect young men and older men too. For the most aspect, it was all older people. Client.
Not really because U of C, University of Chicago, is like a mecca. So people with unusual kind of things going on would go there too. So no, it wasn't all older men. It was pretty much a mix.
Gotcha. From an integrative standpoint versus clinical, we take a deeper dive. We test total and free testosterone, SHBG, DHEA, estradiol, insulin, and cortisol. We assess sleep patterns, nutrient levels, gut health. The gut health was big for your husband,
Yeah,
right?
it was.
Especially seeing an organic acid test to find out.
That was a big deal because, like you were explaining to us, if there's a coating on the lining of your stomach, it doesn't matter what you're taking and how often, it's not going to absorb. You're
Exactly.
doing nothing. So if you do that and address that first, now your supplements are going to be doing something.
Yeah, and
That was a big deal.
and that's where testosterone could raise, right? You address the gut health issues and the absorption issues. Now you're eating properly, or at least now you know how to properly eat. Because we saw that between both of your tests is you may need a lot of meat where he does not need a lot of meat. And people don't know that. Without that functional lab test of organic acid test or stool test, you're not going to know if you have candida or bacterial overgrowth, fungus
Exactly.
overgrowth. And you're not going to know that your body's not absorbing stuff, such as if you have normal vitamin C, but your husband's vitamin C levels are zero, even if they take vitamin C. What's the reason for that? Because candida overgrowth. So again, there's a lot of ways to address this, but we look at that bigger picture. We look at blood sugar dysregulation, which is often a hidden cause of low testosterone. Explore lifestyle factors, chronic stress, alcohol, poor diet that suppress hormone production. Rather than jumping straight to TRT, we often start with foundational support, zinc, magnesium, vitamin D for natural hormone production, ashwagandha for testosterone, stress resilience, high protein diets and strength training to build muscle and increase testosterone naturally. It's individualized, so not everybody's going to have the same outcome as we saw with your husband. He does not need to eat a lot of meat versus somebody else that's going to need to eat a lot to increase testosterone.
No, I'm thinking right now about the candida overgrowth, and this is maybe a factor in you're taking a certain medication and every year it goes up and up because you get less and less absorbed. We hear about get a colonoscopy, get a PSA, get a breast exam, but you never hear about let's check and see what your stomach lining is because nothing is helping you. If you have to go up in your levels of medication, shouldn't you look at your gut? Shouldn't you just take a minute and look at what's happening?
And you hear more and more people because of research that's coming out about your gut is your second brain.
No wonder it's so big.
It's very important to address gut issues, and a lot of people do not because a medical doctor does not look at your gut issue.
Exactly.
Because even if you go for a colonoscopy and stuff and they say, oh, you have high stomach acid, whatever, for the different scopes and stuff, or you have polyps or whatever, they do not address, okay, you have candida, you have this bacterial overgrowth.
Exactly.
Your body's not absorbing these nutrients. They will not address any of that. They will not discuss it. And again, I don't blame any medical doctor. It's not their career path. It's not what they do. So Andropause still does deserve as much attention as menopause. A lot of people need to know that men go through things too. You hear, same with men, women are in their period at times, and then men have these same symptoms of they're crabby, they're this, they're
They
getting
go buying
pimples.
trucks. Yeah.
They get hungry for some kind of food or a taste for something. And a lot of times maybe they're going through their monthly cycle too.
Yeah. Oh, I totally believe it. Totally believe it.
So when men are educated and
There's days I
supported,
just shove chocolate at them. Okay, we're done.
For sure. But when men are educated and supported, they experience this transition as a reset, not a decline with age. It's a different way, but things got to get addressed for both men and women.
Agreed.
Building your menopause and andropause plan, let's talk about that. So, most people walk into these transitions with zero preparation. But just like any major life event, planning can make a massive difference. Menopause and andropause support plans should include personalized based on labs, symptoms, and lifestyle, multiple dimensional, supporting physical, emotional, and cognitive health, being flexible, able to adapt to these body changes. I think it has to come from both sides, right? If you're married, the men and women need to understand what the other person's going through.
Oh, absolutely. And I was just going to say, even after my hysterectomy and they do the post-op visit, I was pretty much told you're not going to get, and you don't need chemo radiation. You're not going to get any replacement supplements. So you're on your own. And
Yeah.
you don't have to get any more pap smears because there's nothing there. So I was just on my own. That
Yeah.
was it. That was the explanation. That was it.
Do you think it'd be different if it was through like a hormone clinic and you're getting a menopause?
Absolutely. I
Right.
never had a hormone test until we came to you and we had to do the mindful.
That's sad because medical
I
doctor
know.
should be running these labs and they
Don't
do
you
not.
think so? That's why I'm on my own because I had a surgery and now I'm done.
You had to think, like you said, they don't have time. And they're busy enough just treating a symptom. So why are they going to look at the root cause? Again, from an integrative health perspective, we're subclinical, so we look for the root cause. We don't treat anything. We'll understand your symptom, but say, okay, what's causing that symptom? If you're born with Down syndrome, you have Down syndrome. But if you suddenly at age 35 start getting migraines, so there's a root cause, or you start randomly getting hot flashes, what's the root cause of that? It's not because you just randomly got some health disease. And that's why I think a lot of people don't understand. They blindly think their medical doctor is there to heal them, and that's not what a medical doctor does.
Correct.
The medical
Yeah.
doctor is there to get you by, treat the symptom. Yeah.
Exactly.
You do have the ones that look at the integrative lens and say, you know what, there's more to this. I don't want to give you this medication because it has these side effects. I suggest you reach out and get a health coach or something, or a nutritionist and work on your nutrition. You may come across those doctors, but they're more rare. I do think more medical doctors are now seeing clients decide, hey, I don't want just a Band-Aid approach. I want the root cause. But that's where a medical doctor come back and say, you know what? I technically don't have time to do this, so I'm going to
Exactly.
refer you to somebody else.
Exactly. And my experience is if you go to a doctor and you say your symptoms and you get testing and they give you a treatment, no matter what it is, if you come back after the treatment and you feel better, even if it's marginal, they feel like they did their job. That is my experience.
And that's why I say I never blame medical doctors. It's just not what they do. It's different from what an integrative health coach does and an integrative health practitioner versus a medical practitioner. It's just a different world we live in. And again, we focus on that root cause and nutrition as the primary objective versus a doctor just treating a symptom. So definitely difference. Now that you lived through menopause and worked with so many others, what would you tell somebody just starting their journey, whether it's a man or a woman?
I would say make a list of your symptoms. And when you go into the doctor, get a clear explanation. If you're not happy with it, if you didn't understand it, don't let them off the hook. They're there to at least give you an explanation. If I was going to do it all over again and I knew Dr. Sproul, I would go for the panel of testing so I could get a full picture. I never felt like I got a full picture. I got treated and I was pretty much put on my own. I survived, but I don't feel like I had the full picture until I recently had these tests. So I would say get the full picture.
And you think a lot of people do not have to go through a lot of these major symptoms if they can rebalance their
Absolutely.
body. I know a lot of people do get upset at their medical providers because, oh, I went to this doctor. They said there's nothing wrong, but I know there's something wrong with me. And they don't get the attention they deserve. And that's why you see people shop around from doctor to doctor or from specialist to specialist. Because I think a lot of medical doctors, too, they're trained certain aspects. Certain aspects they don't know. Oh, I don't know hormones, so you're going to have to see a hormone specialist.
Exactly.
And then if you go to some of these hormone specialists, they're like, in this clinical setting, you have night sweats and this, you need hormone replacement therapy. Okay, but could I address these naturally? We're not going to look at that. We're just going to give you this. Do you want it or not? You take the good and the bad, and it depends what do you want to go through. And a lot of people, I tell them, you're spending a lot of money just by using insurance. And a lot of people think on the integrative health side, because we do cash, credit card only, our fees are so much cheaper than medical, and it's cheaper than using medical insurance, but a lot of people just want to use their medical insurance.
That was an eye opener for my husband and myself because we've been through it on both sides now, on both sides of being a patient and being the provider, doing things for people. What an eye opener for the money that we invested in learning more about what we were going through. Spent,
Oh, yeah.
well spent.
Because you think too, say we run an organic acid test on your stomach issues. We look at that and say, okay, here's imbalances here. Here's where you low on neurotransmitters. Here's where this issue is with your different vitamins. Here's where there's fungal overgrowth. Versus going through 5 different specialists with all
Exactly.
scopes
Exactly.
just to say, take an antacid.
Exactly. Maddening.
Yeah,
Yeah.
but you hear the pain people get through, or they went through, did the scope, and now it tore their insides.
Oh, and
Eh,
that does happen.
and it wasn't even needed
Right.
because there was an
Exactly.
issue with bacterial overgrowth in their
That
stomach.
happens.
It's a definitely scary world, but that's what we're trying to educate people to understand. There's more out there.
Exactly.
There's cheaper solutions that are more in depth, and we're very focused on looking at that big picture and getting right to the issue versus going through all these specialists and spending all this money. Because people will gladly use insurance to spend $3,000 to have the scope done to find out everything's normal.
And they'll be happy with that information, but it's any more ahead. Do
No,
you feel any better?
yeah, that, and then they still feel horrible after the fact, and they were told everything's normal. What's the actual issue? Because I'm having all these problems with
Exactly.
bloating and stuff like that
Exactly.
too. And again, it's based on education. So that's where we do it from a perspective of not using insurance. And the difference is when we do not use insurance, we're able to run any test we want. So we can run these different organic acid tests. We can run different lab work, functional labs and stuff too that a medical doctor can't run because one, insurance isn't going to cover it. And then 2, it's not in their contract. They're not allowed to run certain tests.
The other thing that my husband and I were really impressed with was the testing that we received that let us know which foods we were more sensitive to. We had no clue. We had no clue at all. And that was some good information because it's like all this time we're eating this and eating that. And now when we saw this chart where some of these foods were creating sensitivities, it was an eye opener.
I say the 2 main tests we always do is initial food sensitivity test, and then a secondary is the organic acid test because usually those 2 paint a great picture. Then
Mhm.
outside of that, if it's hormone related, we'll run a hormone panel. Integrative care, the support might look like running a Dutch panel or our in-depth blood work such as you guys ran. Using food as medicine, track your protein, fiber, micronutrient intake. I think that's another issue is a lot of people do not track or understand what they're eating on a daily basis. And a lot of the things they're eating, like you said with your food sensitivity test, how many of those things were you eating on a daily basis
Right.
and you shouldn't be having them?
Exactly.
And
Eye opener.
if you went to the medical doctor and said you have bloating, do they say, hey, let's run a food sensitivity test on your nutrition?
No, not at all. We can go anywhere from imaging to surgery to maybe this is just something that happened did you fall or are you bleeding internally? They're not going to treat it like that at all. It's telling you something. Like you've said in a lot of your other podcasts, your body is talking to you.
We always say prioritize sleep, stress management, muscle building workouts, journaling, or working with a coach to uncover emotional blocks and goals.
So important.
For men, it's the same. Build a roadmap. Don't wait until the symptoms are so severe. Invest in testing in your community and supportive strategies early on. And the other aspect of it too is my saying I always say is if you can't afford to be healthy, you definitely can't afford to be sick.
Oh, yeah.
But people wait until their symptoms are so bad to where they address it. I have to say my other complaint is a lot of people love to vent about their health issues and they care so much about their health, but they do not invest in themselves.
Okay. So this is what we call secondary gains. Do you know what that is?
No,
Okay.
explain it.
So secondary gains is I'm going to tell you that I'm sick and I'm going to give you my symptoms, and I'm not going to do anything about it because if I don't do anything about it, 1, you'll feel sorry for me. 2, I won't have to do things that I don't want to do. I won't have to participate in certain things. I can have an excuse for things. It's a secondary gain. I got it and I don't like it, but because I got it, I get out of stuff. That's secondary gains.
That makes sense. And that a lot across the board. And that's why I always said I do not understand that people do vent a lot. And I understand people like to complain and stuff too. But they do not take their health serious until something wrong. And like we said before, when's your health important to you? Is it when you get cancer? Is it when you can't walk anymore? Is it when you're on 15 different pharmaceuticals? Like, when's it important to you as an individual? And I
Mhm.
think a lot of people just, oh, I don't have time. They don't take their health seriously.
Exactly.
They have no problem showing up to work and working hazardous jobs and doing all this, eating
Mhm.
junk, but they don't focus on their health. And you'll realize it when you're older how important your health is.
Absolutely, you will. And if you're married, you know what? You owe it to your husband or to your wife to be the best physical shape that you can. You don't want to get to retirement and now you're not able to do what you had planned to do. That's not fair.
And you don't want to feel that okay. You want to feel optimal. And
You
that's what
do. You want to have that energy. You want to have that like get up and go. You know, when you finally get to that point and you're with your husband and your wife and it's okay, now we can do those things that we planned.
you want to be that 70s, the new 30s.
Exactly.
That's where it's like you had to look at hormones and say, okay, am I tired all the time because of this? I think a lot of people too, you hear that about tiredness and all that stuff too. I think a lot of it relates to nutrition because they're not eating properly or enough.
Oh, for sure.
So they're not getting that balance of nutrition there, and it just takes effect on your body. And a lot of people understand how important nutrition is. They just know I need to eat, but they don't understand what it's doing to their body until it's too late. Yeah.
And to that end, I just want to say when you were recommending a protein drink for us, there's a lot of times when I know I should eat, I don't feel like it. I have this love hate relationship with food, but I will always have the protein drink. So it's a way to get those nutrients in. It's, you know what? There's always a way to do it.
I tell people always at least to do what we recommend is those foundational supplements, multivitamin, vitamin C, B complex, vitamin D3 with K2, zinc, omega 3s. If people get those, they'll actually be well rounded there. And then they could address their other deficiencies. But at least they'll help balance basic nutrition and get them on the right path. And then from there, we could tweak it just to get to the optimal stage. So again, it takes time. Healing's not overnight. And the other thing with medical side is client patient has no issues going to a medical doctor, taking a pill. Here's a pharmaceutical. It's going to take 3 months to start working. That could be anxiety, depression,
Exactly.
whatever. They listen, take it for 3 months. But then on the integrative side, here you're low on vitamin D, and vitamin D is a hormone and it really affects your body. Same with zinc, and your levels are very low. Start taking this. They take it for a month or even weeks and say, oh, it doesn't do anything. I stopped taking it. I don't get that concept. I understand that they just solely trust their medical doctors. But how many of those people that purely rely on their medical doctors have the worst symptoms? They're always in pain. They're always having health issues. They're always going back to their doctor, always getting on a new prescription. I've never heard somebody go to a medical doctor and then leave there and say, man, I feel the best I ever felt in my life. I'm going to start working out again. I'm going to start this. Have you ever heard that? No.
No, no, never. I have never heard that. And here's the thing there's a time and a place for that. You break your arm, you have a heart attack, you're going to the hospital, okay? There's a time for that. There's things that they're really good at, but there's other things they don't see the whole picture. They look at like the perimeter, if you will. And if you're okay, if you're within the limits, if your labs are in the limits, you're good. So there's things that they do very well, and there's other things they don't have the time, they don't have the training, they don't have the initiative for it. If you want answers, you're gonna have to go somewhere else.
That's where we partner with different medical providers to offer that additional support. We partner with our primary care physician. So any of his clients, patients that decide, hey, I don't want pharmaceuticals anymore, or these pharmaceuticals aren't helping. What could I do to better my health? And they would refer them to us. And
Exactly.
it-
Instead of my husband getting another pillow, another expensive mattress, another set of insoles, okay? He actually went kicking and screaming to a chiropractor who was so fabulous, he signed up right away to come back the next week.
yeah,
Because there were some things that those material things and at our primary care was not addressing. I have hip pain. Our doctor didn't address that. All of the insoles, all of the pillows, all of, the mattress we have a Stearns and Foster. Don't be impressed by that. That was not helping his pain. He went to the doctor you recommended. He went to Dr. Tejada, and he immediately felt better after the first session. Okay? There's some things that you have to look beyond. If you want to keep spending on then the pillows and the mattresses and all that stuff, go ahead. But if you're not getting better, Try something else.
If he went to a medical provider and said, I have lower back pain,
And he did.
and what would the doctor usually do?
Took an x-ray, said, "You're fine."
Yep. That or give you a pain medication.
Exactly.
No.
She didn't want.
That's the different options there. That's why we focus on integrative health. And that's where chiropractors look and do that same work. They focus on integrative health, but on the spine. They understand nutrition and stuff too, but they'd still refer you over so we could address, run organic acid tests, all these other tests while they're addressing your spine issues. That's why we refer people over to Precision Healthcare because they're great at doing what they do.
They are
God is a good guy.
absolutely, absolutely.
When's your health important to you? And same with menopause, andropause. When's it important to you that you're going to address these things or are you just going to deal with the symptoms? And if I was you, I would understand what my body's doing so I could help address it so I don't have to have these symptoms and save your marriage.
Absolutely.
Yeah.
I said to Dr. Tejada, "I just want to hug you right now."
Yeah, it's a different world once you start going chiropractor. And you get the people that are afraid of chiropractors, but it's because of
I think it's
miscellaneous
lack of
people.
knowledge.
Knowledge
It
and
is.
and there's a
Can I tell you something that impressed me is that this isn't some voodoo little hut thing. You go in, it's a professional office. They take a full x-ray and show you what they're looking at. Now, for us being in the medical field for so long, I'm like, look at that. This is why you're living like that. And then he proceeded to put a TENS unit on him, and then he put him on a table with all kinds of stuff that looked like it came from Lowe's, and then he massaged him, and that man came out of that office a different person.
yeah.
And
So
he did not get that in all the years going for a physical.
from a chiropractor perspective, they're focused on the spine and realignment with the discs and stuff, while we focus on the inside of the inflammation aspect of
Which, by
those
the way,
pains.
since we've been taking the supplements that you recommended, just really feeling better.
I was going to say you look 10 years younger.
I'll pay you later.
But when you understand the why, the what becomes
Exactly.
far more easier. That wraps up today's Real Talk on menopause and often ignored conversation around andropause. Huge thank you to Bernadette Talley, not just for her nursing experience, but her vulnerability in sharing what the transition was like from the inside out. So thank you for being here, Bernadette.
Oh, thank you.
Whether you're going through it, preparing for it, or supporting someone who is, know this: you're not broken, you're evolving, and there are tools and strategies and support systems that actually work. If today's episode helped, share it with someone who needs to hear it. The information provided in this podcast is for educational purposes only. It's not intended to replace medical care, diagnose any condition, or serve individualized health advice. Always consult your licensed healthcare provider before making any health decisions. We'll catch you next time on Real Talk, where real healing always starts with an honest conversation. Stay curious about your health, as you are the only one in charge and responsible for it. Stay well.